So this class is on dyslipidemia, obesity, and diabetes. And students will present some interesting news stories or other items related to one of these topics during class. So dyslipidemia, also known as high cholesterol, hypercholesterolemia, depends on the types of lipoproteins that are circulating in the blood. So chylomicrons are the intestinal absorption of your free fatty acids, of your dietary triglycerides. Then when we look at the different types of lipoproteins, the very low density lipoproteins, they also transport triglycerides. Most of us are probably familiar with the LDL type of lipoproteins, again, LDL cholesterol. So that is the type of cholesterol that causes atherosclerosis. And then the high density lipoprotein is the one that causes, it does not tend to cause atherosclerosis. So if we look at the National Cholesterol Education Program guidelines, or NCEP, these are very similar to the ACSM guidelines. So triglycerides are an important risk factor. So when you are looking at your blood test from a yearly physical, less than 150 milligrams per deciliter is normal. High triglycerides can be an indicator of increased risk for diabetes as well. Your total cholesterol, less than 200 is desirable. Starting at 200 to 239, that becomes an ACSM risk factor for heart disease. So that is considered high, and then greater than 240 is very high. We also need to look at the LDL cholesterol. Generally, the lower the better. Less than 100 is optimal. And then ACSM considers it a cardiac risk factor when it reaches a threshold of 130 milligrams per deciliter. HDL cholesterol, happy cholesterol, the good cholesterol, less than 40 can be a low ACSM risk factor, and that's a lot of it has to do with genetics, but greater than equal to 60 milligrams per deciliter is a negative risk factor for heart disease. So people can be all over the place with these. They could have a very good total cholesterol, less than 200 milligrams per deciliter, but they could have very low HDL. So that's going to increase their heart disease risk. They could also have a very high cholesterol level. They could have, say, a 220 total cholesterol, but their HDL cholesterol might be 85. So that's not as risky as someone who has a low HDL. So you have to look at it in the context of the whole picture. If you only have total cholesterol, use total cholesterol. If you have the breakdown, which most people, if they've done some sort of annual physical or screening, they are going to have the breakdown. So use the information that you have. Treatments for high cholesterol. For a lot of people, weight loss, dietary changes. So it's going to decrease your total cholesterol and LDL. It's going to increase your HDL. So the one thing to keep in mind is, the types of diet. What is the ratio? High carb, low carb. High carb can lower HDL, so that may not always work for some people. But in general, weight loss, regardless of the type of diet that people undergo to do that, is going to lower total cholesterol and HDL. Exercise, as many of you know, that is one great way to raise your HDL. So that's why we want to encourage people to be active. Then there are the medications, the statin drugs, or what they are called the HMG-CoA reductase inhibitors. So that is the enzyme that turns on LDL cholesterol synthesis. So you're probably familiar with a lot of these brand names, Lipitor, Zocor, Crestor. Note that they have the suffix OR. Side effects, muscle creatine kinase, creatine phosphokinase. It can cause muscle breakdown. So if people have muscle pain, if they are having, brown color in their urine, it could be a serious emergency if they're taking some type of statin drugs. Some people have to use medication. Diet and exercise sometimes do not radically impact their HDL cholesterol levels or their LDL cholesterol levels. So sometimes, especially if someone has a strong family history of dyslipidemia, they have to take medications. One thing that's important to note was certain medications have interactions with foods, and the statin drugs are one of those that has interaction with grapefruit. So people have to watch their intake of grapefruits if they're using drugs for cholesterol.